had patients ask us about the infection control protocol that we adhered to during the COVID time, so we decided to make a short video to explain the procedures to you. In the morning, before you arrive, you will receive an SMS of the basic steps to follow. When you arrive at the practice, you will park, you will send an SMS or your phone up to let you know you've arrived. As soon as we're ready for you, we will come and call you, or we will phone you. You get towards the practice, the door, you disinfect your hands. As soon as it gets disinfected, they will open up for you. As you move into the practice, you will see immediately at the bottom that there are zones. This is the pink zone, which only allows booked patients and the staff to enter. The reception is clear of any clutter and magazines, and we have disposable water cups for you. When you arrive at reception, Claire and Renee, they're all dressed in their PPE behind the screen. They will receive you and they will ask you to complete a form, and your temperature will be taken. Even all the staff in the practice, their temperature is also taken every single morning, and then it is recorded and kept in a file. Every 1 to 2 hours, the whole area that is touched from the handles to the front desk is disinfected. You will be called to come through to the surgery. The surgery is the red zone. So nobody at reception is allowed to move over this line, and once you're here and the procedure is taking place, we won't allow you to come over again. We'll ask the patient to enter. They will remove their mask and take all their belongings, personal belongings, and put it inside a brown paper bag, which you will receive back afterwards. We will ask you to wash your hands with soap and water to dry, and then very important, we ask you to pre-procedural rinse with hydrogen peroxide and water, which we rinse for 30 seconds twice after each other. So after you've done your rinsing and you put away your mask, you will be asked to sit down at the chair. A dental assistant will also give you glasses to wear. And what we also do is we make sure that there's a 30-minute waiting period between patients. So we have all the aerosols settling. We actually disinfect all the surfaces and wait for 10 to 15 minutes before we clean. Even the floor gets cleaned in between patients. And then we have an air filter. It also purifies the air. And then we clean it. All the filters in here, they are HEPA filters, UV, and it's cleaned at least once a month. And each of the surgeries has one. An extra feature that we have bought for the practice is the vacuum system. The vacuum system is a very strong vacuum that as soon as we do any procedures that's in the chair, immediately it will suck it up, so there is no spray going up into the air and affecting the next patient or any of the dental assistant or dentist. We also have water. The water that comes out here is not municipal water. It's water that has gone through reverse osmosis and UV light killing any bacteria and viruses. So it's clean water that actually comes out into your mouth. As soon as we finish the procedure, the dental assistant and the dentist or oral hygienist will first wash their hands correctly, dry, and then put some alcohol gel on, and then they will move towards back while you will stay seated in your chair. We can disinfect again. In the sterilization area, we have a red zone where we actually take off our gloves and all the PPE that has been used, and then we put our jackets in this basket which gets washed on the premises with special disinfected soap. Then we move over to the orange area, where you will then proceed to go out and collect your patient. You will then go with them to reception to make your next appointment. The dental assistant will again put on her gloves. She will be fully clothed, masks, and also a visor and her jacket, and then she will start cleaning your instruments. Very important, we first scrub your instrument with water and soap and a scrubbing brush. We rinse, dry, and then we put it into an ultrasonic cleanser, which actually vibrates. Inside this cleanser, the ultrasonic, we also have a disinfectant, and straight after that we will rinse it, dry it again, and then it gets sterilized in our statins, and these are little packets, they're sealed packets. What we also have at the practice is our protocol. It is our shock's injury protocol, and also we all are inoculated against hepatitis B, and we have posters up of the way we should be sterilizing the instruments. Here we have a machine. It looks very funny, but it's for hand pieces. So even the hand pieces that we use are sterilized in between every single patient, and we use distilled water. As soon as we've gone through the whole process of sterilization, we will also have our first aid kit here ready for anybody if we have any emergencies. And from here we can then go out towards the pink zone again. And this we've made our area. Usually we have meetings in here, but now it's where we get dressed for every patient. In between every patient, we have our little gowns. We have that for our heads and for our feet coverings, and we even have our plastic aprons. So this is where we get dressed before we actually leave and come and call our patients. Very interesting, we also have the bathrooms where if the patient goes to the bathroom, as soon as they come out, we actually clean the entire bathroom. The staff have their own bathroom downstairs, and that is what they use. So we don't mix the bathrooms at all, and the bathrooms are cleaned in between every single patient. As soon as the practitioner has finished, they'll come and call the patient, but first the patient will be asked to use gel on their hands. Then they were able to take their brown paper bag to the front, where they can then put on their masks before they leave the surgery. And that is a short and sweet of what we do here at our practice. If you have any more questions, you can then contact us or like us on Facebook.